Today, Dr. Anthony Fauci discussed the FDA's approval of the Pfizer vaccine yesterday. He believes it will motivate people to go out and get the shot, but also talked about what might come next.
You know, it's going to depend on us. It really is. It's in our hands. Our fate is in our own hands. It probably will be, as I've said a couple of times, if we do it right and get through the winter, I hope as we get to the spring of 2022, we'll be there. I hope so. It's up to us.
And so we're hearing from local healthcare leaders who said it could feel like we're repeating history, but actually they say taking steps in the right direction. NBC 26's Eric Crest reports.
Some hospitals are starting to limit visitations again. An increased amount of businesses are grappling with their mask requirements, and the ongoing debate about students and what makes them safe in the classroom continues into yet another season.
They're tired of masking, they're tired of not gathering in groups, and tired of not doing the things that they enjoy.
Dr. Sarah Luloff gets it. A new round of COVID fatigue is setting in, and people are easily triggered when it comes to vaccination discussions. But she says now is not the time to let your guard down.
If you look at the Brown County data, we are seeing a 47% increase in cases of COVID over the last 2 weeks. If you look at hospitalizations in Brown County, we're up 130% from 2 weeks ago.
But with 53% of Wisconsinites currently vaccinated and the percentage slowly rising.
Only about 1 in 3 adults in Wisconsin are unvaccinated at this point.
Healthcare leaders are optimistic we're headed in the right direction, especially considering now we have a weapon that didn't exist last year.
Last fall, we didn't really have many tools to avoid where we're at, so it was sort of depressing for everyone because, there was nothing that we could do. But
Dr. Brad Burmeister says the Delta variant is ramping up hospitalizations for the young, the unvaccinated, and it's something few expected to see just a year ago.
Early in COVID, prior to vaccination, your typical patient was in their 70s and their 80s and really did not do very well with the COVID infection.
And while it's unknown whether or not Wisconsin is about to endure a repeat of restrictions, closures, and mandates due to the virus's spread,
This virus is everywhere right now.
doctors remain optimistic that our country won't have to wait until spring of 2022 to get a handle on this virus.
Vaccines are so easily accessible to get right now.
At this point, we have a fully approved vaccine available that can prevent this from happening again.
In Green Bay, Eric Crest, NBC 26.